Hi everybody, this is Dr. Ward with the Ward Institute. I wanted to talk to you a little bit about cheek implants. I should be a little bit more generic in my language because although I'm talking about cheek implants like a surgeon would, I should talk overall about cheek augmentation, or making the cheeks bigger or stand out more. The most common way to make the cheeks stand out bigger is with filler, where we add filler, usually hyaluronic acid, sometimes things like poly-L-lactic acid, to add volume into this area here and make the cheeks stand out more. Why do we care about that? Well, we care about it because the cheeks are like the bottom part of the frame of our eyes. The brow is the top part, the cheeks are the bottom part of the frame. So we want a nice frame to really capture the eyes, because that's what we look at when we look at each other, is our eyes almost the entire time when we're talking to one another. So that's why cheeks are so important. Like I said, we can do this with a non-surgical approach where we add some filler in there. It's an awesome procedure. It works really well. It's well tolerated. It's not painful really at all. The results can last 6 to 18 months, sometimes a little bit longer depending on the type of filler that we use, and it works beautifully. It's not permanent though. That's what kind of bugs a lot of people, is that it's not permanent. An option that is more permanent is if we want to do cheek implants. Now, cheek implants are silicone implants that we place and secure right here to the cheek to permanently add volume. So if you have these cheek implants put in, they last forever. They're going to stay there forever, and you'll never have to add filler there. I mean, you could add more filler if you want to, but at least gives you bigger, bony sort of background. So think of it as like, if we want to add more volume here permanently, more bony volume, then a cheek implant is a good procedure. It can really help demarcate where the light reflects off our cheek here, and then the shadow right here. So it's a great procedure for that. We will often do these procedures in conjunction with a facelift, or sometimes with a lower eyelid procedure to help give better support there. Not always, but often we will do that. The procedure itself is done by making an incision inside the mouth. We go through right on top of the bone, make a little pocket for the implant. I will almost always, not always, but almost always secure that implant into the proper position with a little titanium screw. That titanium screw isn't affected by metal detectors or anything like that. You don't have to worry about like setting off the metal detector in the airport. You can get MRI scans, that sort of thing. But it just helps stabilize it, make sure that it stays there. By permanently adding that extra volume, it's like we're making your facial skeleton a little bit bigger so that you have more room to have the cheekbones that are bigger. So it works great. It helps really delineate the eyes more. It gives kind of that convexity to the cheek that we want, and hopefully helps hide some of the fullness of the lower cheek in many cases. Because that's what we really want. We want kind of this convex, concave, convex sort of appearance along the cheek and along the face. So that's how those implants work. In terms of risks, we are making an incision through the mouth and we're putting it into that area. So there's going to be a scar there. Thankfully, there's no scar that you would see unless you're looking kind of way up in under your lip. That scar heals well. By about 6-12 months, you might not even be able to see it, even if you're looking for it. You might be able to feel it with your tongue or something, but it's unlikely. We are working by one of the nerves here. And so there's, at least in theory, a risk of nerve injury. I've never seen that, I've never even heard of that, but in theory that's a risk. Because we are doing surgery, there's always a risk with any surgery of bleeding, bruising, infection, swelling. Those aren't even risks, those are just things that kind of can happen. The risk is pretty minimal, but it's something you need to be aware of. In terms of infection risk, I give everybody an IV dose of antibiotics right before surgery, and then I give them some oral antibiotics typically after surgery. The other things that can happen with these implants is they could get infected, and if they get infected, you would have to take them out, let it heal, and let the body kind of recover. The other thing to keep in mind in terms of risk, which is the risk for any aesthetic procedure, is that it may not look as good as you'd like, or it may not give you the same result that you're expecting. There's no guarantees, of course. Having said that, this is a really well-tolerated procedure. People really enjoy it and they really love it. So it's a great procedure. It's been around for decades. People have been using these for decades. They work great and they're a great value. Some common questions about cheek implants that we get are, well, do I need to have surgery? Is there an option besides surgery? Well, no. Like, you can do cheek filler. It works great. In fact, that's kind of really shifted us and our practice patterns quite a bit. We are more commonly using cheek filler than we are cheek implants. On the other hand, if you're like, gosh, I'm tired of getting cheek filler every 6, 12, 18 months, I want something more permanent, it's a really great option. The other alternative to cheek implants, though, if you don't want the implant in there, is you can do fat grafting, where we take some fat from your abdomen, from your thighs, and we inject it into this area here. The advantage of that is, like the implant, it's there forever. Whatever fat that we inject and whatever that fat lives is going to be there forever. Now, not all the fat lives, but enough of it does, it's going to give you a good enhancement. It's not going to give you probably the same line of demarcation or the sharpness that you maybe would want. Some people want that. So if that's what you're really looking for, then you may want to move closer towards a cheek implant. But it is definitely going to help and improve things. An advantage of the cheek implant, though, versus both filler and fat, is that let's say that you put the cheek implant in and you don't like it, which is a little bit weird to say because it's not like anybody puts these things in there with the expectation that they're going to hate it, right? Like we want it in there because it's going to look good. Well, it's really easy to take out. We just numb the area up, we make a little incision, we take it out, and you're done. So it's not like it's a terrible thing to do. Like if you're on the fence, like, gosh, I'm not sure if I really like it, it's easy to take it out versus fat. It's kind of hard to take the fat out. You can try to do some lipo, but it's not 100%. Same thing with filler. You can try to dissolve it, and that will dissolve, but it's kind of more of a process. So those are kind of some of the pros and cons. Other things that people ask about frequently with cheek implants are, like, what is the shape? What does it look like? There are like a dozen different shapes that we can do. We kind of really fit that towards you. We can even do a custom one where we kind of sketch it out and we draw it out exactly how you want based on your CT scan that we take. So that's an option as well. It's just a lot more expensive to do that, and it's rarely necessary. So those are kind of some of the common questions that people have about cheek implants.